AURN Exclusives with April Ryan, brought to you by the Act Against AIDS Leadership Initiative. National HIV Testing Day is June 27th. Take the test and take control. Visit cdc.gov/actagainstaids to find out where you can get tested for free.
Greetings, I'm April Ryan from American Urban Radio Networks with another AURN exclusive, the first in two parts. Today we're talking about testing with HIV and AIDS. According to the Centers for Disease Control and Prevention, about 1.1 million people in the U.S. are living with HIV. Nearly 1 in 5 people with HIV don't know they're infected. Each year, about 50,000 people get infected with HIV in the U.S., and nearly 18,000 people with AIDS still die annually. Ongoing stigma about HIV continues to prevent too many people from seeking HIV testing or treatment. Too many Americans do not recognize the magnitude of the HIV crisis. Increasing HIV testing is critical to reducing new infections because people who know they have HIV can take steps to decrease the risk that they will transmit the virus to others. Testing is also the gateway to treatment, so people living with HIV can take medicine to help them live a long and healthy life. Also, research shows that people on antiretroviral treatment are less likely to transmit HIV to others. In addition, those who test negative can take action to protect themselves from HIV infection. Today, we're joined by Kathleen Sebelius, United States Secretary of Health and Human Services, to talk about the importance of HIV testing, care, and treatment. Welcome. We're in the inner sanctum of Health and Human Services with the HHS Secretary, Kathleen Sebelius. Thank you so much for joining us.
Great to have you here, April.
Well, Secretary Sebelius, let's talk about testing when it comes to HIV and AIDS. What is the importance about that at this time, 2013?
Well, HIV has not gone away. The good news is it's more like a chronic condition where we have medications that can really allow someone to live a normal life. But if people don't get tested, they don't know that they have HIV, and they can spread it and become very sick themselves. So we think about 1 in 5 Americans who has HIV doesn't know they have the disease, and unfortunately that continues the transmission of the disease.
So is it about stigma or is it about income? What is it?
Well, I think it's all of the above. The largest number of infections are among men who have sex with men, and gay
prison populations, maybe?
Some in prison, some in the outer world. Okay. We're talking about a homosexual population, a bisexual population. There is a lot of stigma. There's a lot of shame potentially involved. There's a lot of feeling that if I go get tested, somebody's going to tag me and treat me differently. The problem with not getting tested is then you don't get the medications you need and you don't get the help you need. And it's particularly serious in the African American community.
When you talk about the African American community and AIDS, women and children, correct?
Well, the largest number of new infections is among, again, men who have sex with men. And the second largest is heterosexual women. Black men and women are still being infected. And in fact, blacks represent about 14% of the American population, and just under half of all the new HIV infections are in the black population. And half the people living with HIV/AIDS in this country are African American, so it's a serious disease. And about 50,000 people become infected every year here in the United States. And in fact, if Black America was its own country, we would be the 16th highest in the world among HIV/AIDS infection, ahead of Haiti and ahead of Ethiopia. So the notion that this has gone away in America is wrong. June 27th is National Testing Day. We want people to start to have conversations. It's particularly an important thing to do when we know that we have drugs available to help people live very normal lives. And getting tested, being on antiretrovirals, taking measures to have safe sexual contact prevents that transmission to another new person.
Do you ever expect there would be a time when HIV and AIDS would be cured? There would be a cure for HIV and AIDS.
Well, two very important things are going on right now. I mean, there's hard at work at the National Institutes of Health, which is also under the umbrella of HHS, on a vaccine. And some progress is made, but I would say it's still a way to go. Starting January 1st, 2014, thanks to the new healthcare law that President Obama signed 3 years ago, never again will an insurance company be able to lock somebody out of the market with a pre-existing condition. What we know is a lot of people living with HIV may not qualify for health insurance, may not be able to get the drugs that they need. So those days are coming to an end very quickly, and that again will be a big step forward.
So give me your synopsis and your final thoughts when it comes to issues of testing in HIV and AIDS.
Well, again, if we have 20% of the people who actually are HIV infected don't know it, that's a pretty good snapshot. So responsible folks get, you get tested for high blood pressure, you get tested for heart conditions, you take advantage of the medical breakthroughs. That same conversation needs to go on around HIV/AIDS and start at a very early age. We need to encourage teenagers to be tested and then to take action to connect with the drugs that can not only save their lives and keep them healthy, but also conduct responsibly with sexual activity. So those pieces of the puzzle are very much there. We really can see an AIDS-free generation on the horizon. People thought they'd never live to see that. But that will only happen if people really step up, take some responsible action, and make sure they're not, if they are positive, that they take care of themselves and take care of the loved ones around them.
Final word on that from HHS Secretary Kathleen Sebelius. Thank you so much.